We're on the last page of notes for joints, and actually this is the last page of notes that's going to actually go towards your third lecture test. This material tends to be somewhat easier, so hopefully people would study enough and make a killing on the exam, because the odd number tests are a little bit easier, even number tests a little bit more difficult. Anyway, at the top of page 14, I briefly went over joint injuries and tried to distinguish between sprains and dislocations. A sprain is essentially in the concept where the ligament is injured. It may be stretched, may be torn. Remember, kind of like taffy, they can be stretched or torn depending upon how the impact actually occurred. And I listed some places where you could have sprains, lower back, ankle, knee, but pretty much any place where there are ligaments. And again, because of poor vascularity, they may be poor to heal. Poor in the sense of it takes a while to happen. Now let's not confuse a sprain with a strain. T versus P. With a strain, that's typically muscles are involved. You injured the muscle, a strained muscle, but a sprain's more along the lines of a joint that's been messed up. A dislocation is actually where you have your bones put out of normal alignment. They've been great forces put in, the bones haven't broken, but where the two bones articulate are no longer in proper alignment. Fingers could be, shoulders. If you dislocated your hip, oh, that must have hurt. And you reduce it, would that most likely be a closed or open reduction? Well, since you don't have anything kind of sticking out, it's not a compound fracture, probably be a closed reduction, which you kind of 1, 2, and snap it back in place. Now, for the rest of this, we're going to talk about joint diseases here. And we'll talk about a couple of them in general, and then we'll go into some details on arthritis. With a bursitis, we already kind of saw that with a bunion, right? Inflammation of the bursa. And all these guys, itis, we have an inflammation. Inflammation can be mechanical. You're working that joint too much and it gets inflamed. It's like tennis elbow or carpal tunnel syndrome. Maybe you have an infection that's causing tissue damage. So it could be mechanical or infection. In origin, typically all these would have similar signs and symptoms of inflammation. You'll be pain, swelling. What else? What's another possible? Redness, absolutely. And how will we treat it? Again, not teaching nursing, but just basics, because we all could end up having some type of joint inflammation. If it's a prolonged inflammation, you may want to treat with anti-inflammatory drugs such as your corticoids. You've heard of cortisol or hydrocortisone. You get a steroid injection essentially, and it will lessen your inflammation. If it's maybe a microbial disease such as Lyme disease, we'll see the use of antibiotics to try to treat the source of the problem, and then the steroids to treat the signs and the symptoms. Now let's go through each of these briefly. Bursitis, inflammation of the bursa, like I said, you've seen that with a bunion, or tennis elbow is typically a type of bursitis. Tendinitis is the tendon sheath that's gotten inflamed. Carpal tunnel syndrome will encompass that one. And then we have the biggie, arthritis. And there's actually hundreds of types. I'm going to kind of concentrate on osteo versus rheumatoid arthritis, and then we'll lastly talk on Lyme disease. Now, here we have a picture of a healthy synovial joint, just as a review. Your synovial membrane in green, your articular cartilage, and basically with a arthritis, this articular cartilage gets messed up, promoting rubbing of the bones, and that becomes really problematic. So when we look at this, and we see an arthritic joint here, and maybe we'll concentrate on osteoarthritis, we call it the #1 chronic type of degenerative joint disease. #1, it's the most prevalent. Chronic, it's ongoing. It's not something where your bones are fine one day, next day you wake up and they're all out of whack there. Degenerative, it's breaking down over time. And it's age-related. Just like anything that you use mechanically, over time things get worn down, they need to be replaced, and a joint is no exception. Fingers can be messed up. Well, again, let's look at this. You see how there's naturally erosion of the hyaline cartilage. You're going to have some swelling going on there due to inflammation. But look at this. Aren't those bones going to definitely be likely to rub together? And that's not going to be good. Let's just kind of look at this picture for the disease process, then actually look at some real images. Normally, the rate of cartilage formation equals breakdown. So you break down a little, you replace it, and you're good to go. But with age, as you get older and older, more gets broken down than gets replaced. So you can see over here how the articular cartilage over here gets eroded away. And the bones will be able to rub together, and they form bony spurs. So pieces of the bone gets rubbed out, and you have little pieces that stick out, and that's obviously going to limit joint mobility. And obviously, if any nerves around there, we know nerves associated with bone, it's going to be incredibly painful. So you have swelling and pain, and you can look at it here. You can see the swelling in the joints here, right? And I mean, this is definitely an old person here. You got a little bit of misshapenness going on here out of alignment due to swelling. And this is your osteoarthritis. I mean, obviously, if you just look at your fingers, nice and straight, and here we got a little jaggedness going on due to the swelling, putting bones out of proper alignment. And this would be painful. And some of you guys may have a little bit of arthritis. You're starting to get up there a little bit. It gets worse with time. Contrast that with this, and you see also, whoa, this does not look normal. This angle is way off. Or we kind of look at this. That's a neat trick, isn't it? We're going into rheumatoid arthritis, which actually has an autoimmune flavor to it. The immune system attacks the joint. Seems to be association more often found in women than in men, and it's not age related. So you can actually be young and having this rheumatoid arthritis. It can affect both sides of the body, bilateral. So you can have flare-up in both sides. And by flare-up, also you're having a problem with it and it goes away. Now, obviously, when we have this in this angle over here, it's not like one day you wake up with this and the next day it goes away. But when it's first starting, you can feel the pain, and it goes away. And that's what I mean by having remission. For X-ray people, without trying to interpret the X-ray, you can tell it just doesn't look like a hand that you'd expect to see in an X-ray. You got it's bent out of shape, and you can see this again, bent out of shape. So you X-ray tech people addressing your needs, realize when you start taking X-rays, you probably, while you won't do a diagnosis, just like a nurse wouldn't do a diagnosis to tell the patient, you yourself will be able to look at a picture and have a good idea of what's going on, because knowledge is power. You really do want to have an understanding. What do we call this? We call this useless. This is pretty much, I mean, I don't know exactly what type of surgeries, and I may be going off the deep end here, but pretty much this hand looks useless, and if it was just kind of amputated, but if a doctor, a specialist, would know how to fix this problem, then obviously go with whatever treatment that is, but this is pretty severe. So what's going on in here? When I look at this picture, we go back to our friend the synovial membrane, and it actually thickens to what we call a pannus. Due to inflammation, it gets thick, so you get a pannus. Cartilage erodes, kind of like with osteoarthritis. And the problem with this rheumatoid is the scar tissue ends up getting ossified, and the scar tissue actually, as it becomes ossified, helps to connect two separate bones together. So if two bones are almost essentially glued together through ossification, then you're going to lose mobility. And the process of doing that, when you get the deformation, deformation as you see in here, we call this ankylosis. So ankylosis is it's a deformity due to bones being fused together, and by being fused together, you actually can get a permanent misshapen characteristic to that body region. Finishing up, Lyme disease. Bullseye marks the mark. Right over here is probably where he had a tick bite. And it releases this microbe that in 225 we'll discuss, but it's a deer tick that gets released, and the microbe actually spreads out. And what do you observe here? What's this? This is inflammation. Here's your redness, and the microbe is very motile. It's mobile. It moves, swims, and every time it swims to a new region, it causes a new round of inflammation. Here it almost looks like a hematoma. Now, as soon as you see that deer tick, you need to remove it, because once you actually start to have some of the signs and symptoms, it's kind of too late for antibiotics to do their full potential. So if you think you got bit by a deer tick, Ixodes, the deer tick, you're going to want to go see a doctor, because this stuff not only will travel through your bloodstream, it can cause neurological problems, it can cause an arthritis, hence it's in this lecture. So this is just an example of how you get arthritis from an infection and not from some mechanical injury or age-related issue.